My name is Dale Maloney. I'm 72 years old, and I'm a head and neck cancer survivor. In 1996, I was diagnosed with neck cancer. I was only 49 years old, and I went into 40 days of radiation, and the tumors went away, and I had to deal with the byproducts of the radiation. My wife noticed that every time I ate, I started coughing, and I started having trouble swallowing. Sent me to the doctor. Doctor immediately ordered a swallow test, and after the third swallow, they stopped the test because it all was going right into my lung. He immediately ordered a feeding tube. That was my local doctor, and my number one goal is not to have a feeding tube. So I went back to my radiologist. He said, before you get your feeding tube in, I want you to go see a special therapist we brought in who specializes in swallow therapy.
Dale and I met 10 years ago, and he was referred to me by a radiation oncologist. He was having difficulty swallowing. He had no sensation at all. He didn't have any reflexes. And so I started with some sensory input. After a while of treating, he started getting the sensation, and then he was able to feel the food in his mouth to be able to swallow it. The other thing that he was having problems with was range of motion. So I also do muscle strength training and myofascial therapy, which is to soften the tissue, to make it more flexible and pliable, and I train him to perform the exercises at home.
I religiously do the exercises, rain or snow, every day of the year in the hot tub. I think the muscles are more relaxed and they seem to stretch easier. Anything different than shaving in the morning, there's some things I gotta do, or else it's not gonna be a very nice day for me. In addition to having swallow therapy, I started having my throat dilated, and Dr. Howell is the one that initiated this type of therapy that no one else had seen before.
I tell patients it's all plumbing. We have to work on the pump and the pipe. So when we talk about dilations, we're talking about the pipe. When the pipe is closed off because of radiation, because of strictures or webbing, it's a narrowing of the pipe. And so what dilation does is it opens up that pipe. But we go very, very slowly. And I learned that from patient experiences. In fact, I learned it from Dale Maloney. He was the one that told me, oh, wait, this hurts. And he's like, let's go slow. Let's try slow. And I have changed how I do it based off of that one experience with him. The other thing that I have learned from Mr. Maloney is also the increments of dilations. He was the first person, now of many, that come in for just regular dilations. So instead of waiting until he gets bad, we keep him at a balance. Mr. Maloney is a trailblazer. He is always asking and challenging in a wonderful way how we can do it better. And I've learned a tremendous amount from working with him. I've learned about him as a person, and I've also learned to see what it looks like to be a person with swallowing disorders and a person who's survived cancer.
You need to be proactive in everything about your health and never be afraid to ask questions. And if you're having swallowing problem today, now's the time to start finding answers. Don't be afraid of it.
I tell patients over and over again what I do. I don't prolong life, I improve quality of life.
Dale's a very social person, so quality of life for Dale means to enjoy meals with his family, going out to dinner with his wife, being able to be part of society and not use a feeding tube and have to use liquid feeds. So we've kept him off the feeding tube for 10 years.
Mr. Maloney is better today than he was before. That's not to say he's done. He has to put the time and the effort in, and it's never done. But right now, he's a tremendous success.
God makes each day for us to take and do the best we can, and I try to live that way. And I'm very happy with my life. Becoming more blessed.